The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Sweaty and pissed. Menopause makes me sweaty and pissed.
Hello, Sweaty and Pissed listeners. This is Karen Nickel, family nurse practitioner, in for Sweaty and Pissed, Menopause, and more. And I am here again with Dr. Kirk Bass and Mandy Baker from the Shea Aesthetic Clinic. And hopefully you tuned in to last week's episode where we talked about urinary incontinence. And they're back again this week to talk about some of the other services they provide. And especially Mandy does the weight loss program, and I know that's of interest to a lot of people most of the time. So I think that'll be really helpful for you to talk about your program. So again, Dr. Bass is a neonatologist who started a Shea Aesthetic Clinic and does both neonatology and supervises a clinic. And I don't know how he has time to do that, but he probably doesn't sleep very much, is probably what I suspect.
Not quite enough, but I'm okay. It's okay. Exciting to have both fields. It's exciting to be in an area of intensive care, and it's also exciting to be in a place of happiness and fun. That's
so true. That's a good balance. And then Mandy Baker is RN, registered nurse who practice. You're not still practicing in a neonatal unit, are you? Or are you still doing that too?
I'm not. I officially retired my tiny stethoscope a couple of years ago, so I'm full time here at the aesthetic clinic.
Yeah, so she practiced at a neonatal clinic for 11 years and is now at Shea Aesthetic Clinic, and that's got to be a different pace and probably welcome change.
100%. Yeah. It's nice to, when you come in, and your patients come in and they want to be there and they leave, feeling good.
Yeah.
So.
Yeah. Very different experience. Very different. But thankful that both of you have dedicated yourselves to that neonatal care, and it's so important for so many people. So I would like today for Mandy to speak about the weight loss program that you supervise and practice, and sort of what that program is, how that works, visits, etc. This is a really big problem. I would say a large portion of my patient population have weight concerns and bring it up at appointments frequently, and it's nice to know what options people have out there to make that goal happen. So how is your weight loss program structured?
Well, I mean, like you said, there's so many people who this is a struggle for. I feel like most of my patients, they come in and their first statement is, since COVID or since menopause, and, they go into the various reasons why, they've put on a weight in the last few years, or they're having difficulty achieving results with things that, maybe worked for them in the past, but are no longer working. So, but, people never come to me as their first, attempt at losing weight. They've done, keto, they've done Weight Watchers, they've done intermittent fasting, they're trying to exercise. And, I think that what we've created here with this program, and something that's so important, is a long-term solution. Mm-hmm. When you're talking about weight loss, there's really not a short-term solution to a long-term problem. And sometimes people don't want to hear that it's good old diet and exercise that's going to get them where they want to be. That's kind of painful. So, I think the first step is, sitting down with the patient and, kind of setting realistic expectations that, hey, you're not going to lose 10 pounds in a week. For women specifically, our goal is 1 to 3 pounds, and that kind of slow, steady weight loss is really what we're looking for.
Yeah, and I'd say more really realistically, it's about 1 pound a week.
Yeah.
I mean.
Yeah, I have some people that will start off when, if they're like really heavy initially, they tend to lose weight a little bit faster because their body wants to be rid of it. I think sometimes we kind of tell ourselves, we're like, oh, my body just loves being this weight and it's, it doesn't want to let go. But if you're honest, your lungs and your heart, it doesn't want to support all of, it's just a lot more work for your body to be
joints,
obese.
Your joints just can't take that.
Yeah.
It's a lot of wear and tear. So, I have patients who come in, and this happens on a regular basis, unfortunately, where they'll come in and say, I've gained weight during COVID, as you said, or since menopause. And they say, what are you going to do about it?
Right. I get that too. I know. And I'm like, oh, that's so much pressure. What am I going to do? Yeah.
Well, I'm not moving into your house and telling you what to do. But so much of it is taking responsibility, I think, is a big, huge piece of the puzzle. So, yeah.
And I think it's hard. We just, I think, naturally kind of get in our own way. So part of, what I do is help people get out of their own way, you know, and I think initially when we started this program, I, just like being the nurse and just kind of the personality that I have, like I want to be able to fix everything. So, that when somebody would come and say, what are you going to do about it? I'm like, oh, I have the perfect plan. This is exactly what you have to do. But what I realized is that's not necessarily serving that person long term.
Yeah.
And, while, that's great to kind of be able to get a jump start on weight loss. What we really try to do is to teach people how to do it themselves.
Yeah.
And they take that responsibility and ownership, and they truly know what to do when they've graduated the program.
That's fantastic. I mean, we have lots of, I shouldn't say lots, but we have many weight loss meds now that 10 years ago we didn't have, 5 years ago we didn't have. And those are very helpful tools, but I'm always reminding my patients, these are tools. This is not the answer. This is a tool that you use, just like you would use crutches when you've got a sprained ankle. At some point you put the crutches down. You can't keep, so it's changing lifestyle is the thing, and it's not easy. So how long is your program? Because some of that is, consistency with meeting and having some long-term accountability and support.
Yes. So patients typically come in and they visit with me once a week. We're together for about an hour. And the first part of the program is 3 months long.
Good.
So and then after that, we call it graduation. Then they can graduate to a monthly visit where they come in once a month, and they can do that as long as they want to. I sat down with a patient the other day, and he actually said, so what if at the end of 3 months I still want to come in every week? And I said, I'll see you every week. So everybody's a little bit different, depending on the type of support that they need. But I never want to expect that somebody is going to overhaul everything immediately. So what we do is try and focus on one thing at a time and put a lot of effort into that one thing until that becomes effortless. And then we move on to the next thing, because I think just change in general is painful. So by saying, okay, you're going to eat all of these, this is everything that you're going to have on your meal plan, and this is how much water you have to have, and this is how much you have to exercise. Like, I can't expect somebody to do all of that at once. I would be setting them up for failure, and I don't really ever want to do that. So we focus on one thing at a time, and when that feels comfortable, then we go to the next thing.
Yeah.
So that takes time and practice, and, and it takes failure too. And I just try and help people become comfortable with failure, and letting them know that that's okay, because if they fail, at least they tried, and that they're in a safe place when they fail, versus if they're at home by themselves and they kind of like give up. So that the length of the program, I think, is really important.
Yeah. I think it's been really difficult in this last year during COVID. I would say at least 80% of my patient population have gained 10 to 15 or more pounds, because speaking of lifestyle change, our lifestyles changed, not for the better so much, because our exercise options changed, and we're home. If you're working from home, you're snacking all the time, or have the ability to snack more frequently. And there's that probably a little extra step of starting to just get back to where you were pre-COVID, and then move from there. So it does take some self-forgiveness at times, so that you can move on. Yeah.
Yes. Grace is so important.
I know. We all need to give ourselves a little more grace.
Yes, 100%. And I think that's a lot of how people get into a body that they don't recognize. They have a stressful life event, whether it's COVID or a relationship or a job or whatever, and it becomes a little too much for us to handle, so we try to kind of like self-soothe. Some people do it with food, and it just, we get into a place where we can't move beyond that. It's hard to, look past those bad decisions that we made, and then we feel guilty. And then we're like, oh gosh, I shouldn't have done that. Well, I guess I'm going to have this other pint of ice cream or whatever. And it's this terrible cycle that we create for ourselves.
Yeah. So. I often tell patients, when we do things that aren't great health choices for ourselves, we do more things that harm our health. If we're tired, we don't exercise. We eat more. It just keeps spinning that direction. And I often tell them, if we can just start spinning the other direction, because interestingly enough, when you do good things for yourself, you do more good things for yourself. So I'm not saying it's an easy turnaround, but it is a possible turnaround. It's definitely something that's doable, and then it can cycle the other way, which I think is so important. But do you offer virtual appointments during COVID?
We do. Yeah, absolutely. We just would set up a Zoom meeting, and one of the things that I do like to do each week, we have an in-body scale. And that's usually the first thing I have people do when they come in. So they get on this scale, and it gives me a little more information than what they're able to gather from their scale at home. So I can look at their body fat mass, their skeletal muscle mass, their water content, and we can kind of tell, we just have a better breakdown of what is going on. So that isn't possible virtually, but what we can do with the information that they're able to gather from their scale at home is look at the trend over time.
Yeah.
So that really, I guess that would be the only thing that would be lacking. But there's still the most important part. I think the reason why people get into a weight loss program is because they need accountability. So,
that's a big part.
So that's still there. Yeah.
Man, I wish I'd have stepped on that scale when I was at your clinic. Find out how much body fat I have. No matter what I do. No.
I know. Sometimes people, they come in and I hand over, you have to use this little tissue that you clean your hands and your feet with before you step on it. And they're like, oh no, they just kind of instantly sink down. I
know. At our appointments, I'll walk out of an exam room and I'll see a patient getting worked up and put on the scale, getting on the scale, and they're stripping everything.
Yes. I know they're practically in their underwear.
Exactly.
Yeah, and you're like, okay. Yeah.
It's so funny watching them take everything off.
I know.
Anyway.
Yeah. Yeah.
Well, it sounds like a fantastic program. Do you discuss supplements or meds, or do you do any of that kind of thing as part of the program, or is it purely diet, exercise, lifestyle change, which are all good things?
It's a lot. Yes, we do. We talk about. We supplement with an injection called Megaburn, and it's mainly vitamins. So a lot of, when you're dieting or you're changing your food habits, sometimes it's difficult for our body to get the nutrition that we need out of what we're eating. So Megaburn, it helps with that. It also helps the body use stored fat for energy. But there's not really anybody who can't take it. Sometimes I'll have somebody who truly is, they're binge eating, or they, might really have an addiction to food. So in that instance, there are some prescription medications that can be helpful for that. But I don't usually guide people in that direction first. The first thing that we work on is education, nutrition education. And I don't even ask them to start exercising right away. The first thing that we work on is what they're putting into their body. We work on the fuel, and then they hopefully, with a little bit of weight loss, and if they're feeding themselves the right thing, they feel a little better moving their body.
Right. I think that's great.
Yeah. But movement is medicine. So that's, something for sure that I like to encourage.
Yeah.
And most of my patients can at least walk. So we definitely encourage that.
That's fantastic. Well, that sounds like a wonderful program. And for those of you out there who live in this area and are looking for a weight loss program option, Mandy is your gal. Mandy's your gal at Shea Aesthetic Clinic. It sounds like she has a really great program for you to participate in and lose the weight the safe and long-term way. I think that's fantastic. So glad that you're doing that. Really glad. So we're going to take a little break right now, and we will be back in a moment, and we will talk about some of the other services that you provide at Shea Aesthetic Clinic and get some more information from you. It's so great to have you here. We will be back in a moment. Listeners, I really want to talk to you about Green Chef, which is the first USDA certified organic meal kit company. You can enjoy clean ingredients that are in season so that they are at their peak of freshness. If you want to make a great meal and save time doing it, Green Chef meal kits are pre-measured, perfectly portioned, and mostly prepped. They have so many wonderful recipes, and you are sure to find a plan that works for you because they offer keto, paleo, vegan, and vegetarian meal kits. One of my favorite dishes is their chicken and veggie pho. That's PHO, a Vietnamese soup that was so easy to prepare and had such a complex and delicious flavor. Never worry that you will not get the nutrients you need from Green Chef's vegan and vegetarian meals because their recipes are high in plant proteins and rich in omega-3s. Listeners, I urge you, if you want easy, healthy eating, go to greenchef.com/90sweaty and use code 90sweaty to get $90 off, including free shipping. Go to greenchef.com/90sweaty and use code 90sweaty to get $90 off, including free shipping. Green Chef, the #1 meal kit for eating well. Sweaty and Pissed listeners, if you are not loving your hair or your hair products, I have the perfect solution for you. Function of Beauty. Function of Beauty gives you customizable hair care by offering you precise formulations for your hair's specific needs. And it's so easy to get the perfect formula for your hair. It starts by taking a thorough quiz, during which you will give them info on your hair type and your hair goals. Do you want your hair to have more volume, look shinier, feel smoother, or is your hair curly, straight, thin, frizzy? Function of Beauty can help you. Next, you choose the color or fragrance of your hair products, or opt for fragrance and dye-free formulas. Then the team at Function of Beauty determines the perfect blend of ingredients, bottles your formula, and delivers it to you along with all the instructions you need. Every ingredient Function of Beauty uses is vegan and cruelty-free, and they never use sulfates or parabens. I love also that they will never use petrolatum. You can also go completely silicone-free if you want to. And Function of Beauty offers completely personalized formulas for body and skincare as well, so you can customize your beauty routine from head to toe. Never buy off the shelf just to be disappointed ever again. Go to functionofbeauty.com/sweaty to take your quiz and save 20% on your first order. That applies to their full range of customized hair, skin, and body products. Go to functionofbeauty.com/sweaty to let them know you heard about it from our show and to get 20% off your order. Since we are often talking about supplements on this podcast, I would like to tell you about Care Of. Care Of is a wellness brand that makes it easy to maintain your health goals with a customized vitamin plan that helps you feel your best today and supports you long term. I love that all of Care Of products are formulated with clean ingredients that are backed by science, and they will always tell you about the research and sourcing behind each of their products. In addition, the recommended supplements come in daily, individually wrapped packets. That is a very important feature because it will help you get into and maintain a daily routine of taking your supplements. I frequently tell patients that it is important to take supplements that are specific to their needs rather than grabbing supplements off the shelf that they hope will help them. Care Of's in-depth 5-minute online quiz asks you questions about your diet, lifestyle, and health concerns to help address your specific wellness goals. Taking this quiz is like getting a one-on-one consultation with a nutritionist, all without leaving your house. Listen up, all you female Sweaty and Pissed listeners. As moms, partners, business owners, women have a lot on their plate. Small routines like drinking a glass of water, taking your vitamins, or adding collagen to your morning coffee can go a long way in helping you prioritize your health and self-care. Why not celebrate Women's History Month by caring for yourself, by taking the Care Of quiz, and start a daily routine of supplements that are customized for your needs. For 50% off your first Care Of order, go to takecareof.com and enter code SWEATY50. 50% off. That's a 5 and an O. 50% off. So for 50% off your first Care Of order, go to takecareof.com and enter code SWEATY50. Well, welcome back, everyone. We're here with Dr. Kirk Bass and Mandy Baker from Shea Aesthetic Clinic. And this portion of the podcast, we're going to speak about some of the other services they have to offer. And I was told Dr. Bass and Mandy that I am not well versed in the aesthetic clinic options. And it's probably very apparent that that's the case. But and there's always new technologies coming out. And frankly, as a provider, it's sort of hard to keep up with everything. So it's good for me to learn what you're able to do, what you have there. So in addition to the Emsculpt chair, which we spoke about last episode, that's made by BTL, which is a international company that manufactures medical equipment. They have some other machines or equipment that you utilize for other purposes. Is that correct?
That's right. We have quite a few things. Most medical spas do offer an array of services, and we're the same. We have other devices from BTL that do great things like body sculpting and muscle building. Just like the chair builds muscle in the pelvis, we have a device called Emsculpt, where you can put applicators on your abdomen to tighten the abdominal musculature and increase the muscle tone and strength. Those same devices can be placed on the biceps, triceps, calf muscles, on the buttocks. So the treatment on the buttocks actually helps provide a little bit of a butt lift for people that don't want to have a surgical butt lift, which can be painful and expensive. And again, it just really contracts those muscles with that electromagnetic field to build the strength of the muscle. The interesting thing about treating the abdomen with the Emsculpt device is that not only does it build muscle in the area, but it also burns about 15 to 20% of fat in the abdomen as well. So that's a really neat device that we have. It's new technology. Cool sculpting is old technology. It works well, but it's older technology. This uses an electromagnetic field. Another device for body sculpting called the Evolve Trim device, which uses radio frequency energy and a technology that's really cool called electroporation, where the radio frequency is basically, added to your abdominal wall or your thighs or wherever we treat, and it creates little tiny holes in the fat cells, which makes them die by a natural process called apoptosis, where there's no inflammation or swelling or redness. And it's a pretty gentle therapy as opposed to kind of freezing the fat. It's more heating the fat, and that's a more comfortable procedure, and it works a little bit better. So really cool body sculpting services here. Mandy can tell you about a little bit of our skin tightening services as well.
Yep. So after you lose all of the weight in my weight loss program, you might have some loose skin that we need to tighten up. So we have a variety of things actually that tighten the skin. We see a lot of patients for facial aesthetics, but also for the body as well. One of my favorite ones that we have is called Morpheus 8, and you can use it on the face, the neck, the abdomen, the back of the arms, really, anywhere. I'm actually doing the top of somebody's legs right now because it helps treat cellulite as well. But it's we call it microneedling on steroids. So we're kind of taking advantage of the body's wound healing process. So we create a mechanical wound to the skin with the microneedling, and the cool thing about Morpheus is we can do varying depths. So if I'm trying to affect the fat layer, I can do that. We get into the dermis and even, part of the epidermis as well. So we're, wounding the skin. It sends signals, to the skin that say, oh no, we've got a wound here. So we're going to send some fibroblasts to the area. That's going to help the body produce more collagen and elastin. And then over a period of 1 to 3 months, that help the skin in the area there is more tightened. And then also the steroid part of it is the radio frequency that's delivered beneath the surface of the skin. So we have that thermal wound as well.
So do you have to use a topical anesthetic cream prior to?
I would certainly advise it. It's actually really comfortable with the numbing cream that we use.
Okay, so you provide that. You don't have to keep a numbing cream in your purse that you bring to the
no. We are gentle and kind, so we'll let you sit in there for an hour with the numbing cream on, and it provides some really great pain relief and comfort. Occasionally we also will have patients that will use Pronox, so an inhaled nitrous oxide, similar to what you would use at the dentist, and kind of helps dissociate them, from any discomfort. So,
And so would that be something that's really helpful for people who complain of crepey skin? Because I get that complaint a lot.
Yeah, absolutely.
Crepey skin.
Yes. We love the word crepey skin around here because it's something that we can fix right up. So
yeah, I think it's so neat that there are so many non-surgical options for
yes.
aesthetics. It's pretty amazing. And on the body contouring, I probably calling it by the wrong name, but is that how long are you in that machine, or is that machine applied? How long does that take?
That's a great question. So the Emsculpt, which builds muscle and burns fat, that's a 30-minute procedure that you have twice a week for several weeks. Then the other one, the trim that uses radio frequency to burn fat, that device is great because it's once a week, again, for about 30 minutes for 6 to 8 weeks. And the cool thing about the radio frequency to burn fat is it also tightens skin at the same time. And cool sculpting is great, but it only burns fat. And if you need to have loosened skin tighten up, you need to have an additional procedure after cool sculpting. So this device not only burns fat, but also tightens skin at the same time. But it's a weekly treatment. So one of them is a weekly treatment. The muscle builder and fat burner is twice a week. And it's several weeks for each one.
That's great. So I do also want to know about hair restoration. That's another thing that and you think that would be just a male issue? I get a lot of complaints from women about hair loss and just, and there are obviously medical things that we can do, medications like spironolactone and Propecia, things like that, topical things. But sometimes it just takes more than those things that I can offer to help with hair loss and improve hair growth. So I understand you do have a hair restoration program. Is that correct?
That's right. We have a program that we modeled after the Cleveland Clinic dermatology practice, and we use a combination of microneedling, well, not microneedling, but we use a combination of platelet-rich plasma that we inject into your scalp. There's actually some new technology coming about where they do microneedling as well. That's why it came to my brain. But we provide a medication it's a nutraceutical, which is basically the types of vitamins and minerals that are important for the building blocks of hair growth. And then we also provide patients with a cap that's low-level light therapy, low-level laser light. And that red laser level of light that's at a particular wavelength has been shown to increase blood flow and help stabilize hair loss and help just improve that problem as well. So we have a combination of those things, and Mandy's been actively treating people. She's even treated somebody very close to her and has had a lot of fun with that.
Oh.
I treated my husband. So he's a performer.
Right.
He's on stage and was on a TV show for a bit. And
So for our listeners, he's a songwriter and performer. Yeah.
Yes. Yeah. And he, so his hair is very important to him. So when he, his hair started thinning, he, was kind of devastated. And I was like, babe, don't worry. Dr. Bass has a plan for you. And he, was super excited whenever we got the program. And he was one of the first people to allow us to use it. And he's had incredible results. But the way I kind of explained it to him was that the PRP is like, I'm like, think of your head as a garden. And, the PRP is the fertilizer and the Therodome is the sun. And, we still use the topical minoxidil and, of course, the nutraceutical. And I'm like, that's the water, babe. And he's like, oh, that all makes perfect sense. But he allowed me to inject his scalp with PRP. Of course, I numbed him for the procedure, so it's super comfortable.
There are a lot of wives who wouldn't do that.
I considered it. I'm like, how nice have you been to me the last few days? I can make this very comfortable, or I can just really show you how I'm feeling right now. But in general, he's a very sweet man, so I was very much inclined to make him comfortable. But we did we ended up doing 4 treatments on him because he had pretty significant hair loss, and it treats it's for AGA hair loss, the androgenetic type. And we do them about a month apart. And then he's continued. He has a little alarm set on his phone to remind him when to wear his Steroid cap. And he's been religious with the whole thing. So he's had fantastic results.
That's
and
great.
You can see his before and afters on our website if you're curious.
And so the monthly part is just wearing the cap, or does he get injections monthly as well?
So the initial series of injections is once a month for 3 to 4 months. It depends on, how severe the hair loss is. The Steroid cap, really, you only have to wear it twice a week. But what we've found is that for people to remember and to do it regularly, that every other day that's kind of the schedule that he's adapted, and that works really well for him. But it's really only necessary to wear it 3 times a week. And then the Votest, those are the nutritional supplements. You take those every day. And then a topical minoxidil, he uses that daily as well. Yeah.
Good. Well, that's great. Yeah, it's a really, really common complaint. So we'll have to be sending some people your way
Please
to get
do.
some hair on their head. So I know you also do photofacials and hydrofacials, and once again, probably you can tell, but I have not had either one of those, and I wouldn't even know what they were.
Well, you would never know, Karen, because you are a stunning lady. But so the photofacial, we use IPL, or intense pulse light, and I kind of liken it to a laser. That's easier for people to understand, but it's pretty comfortable. We put some ultrasound gel on the face, and the treatment takes 15 to 20 minutes. If we're trying to treat brown spots or age spots, usually we do about 3 treatments of those once a month for 3 months. The cool thing about the IPL device that we have is it also treats vascular issues. So rosacea, telangiectasia, things like that kind of happen as we age and the skin gets thinner. Those you'll need about 5 treatments, also spaced about a month apart.
Interesting.
But there's so many other benefits to it as well. It can help with large pores. Sometimes it helps with oil production as well. And my favorite thing is when people say, they're like, I can't quite put my finger on it, but my face just looks better. And I'm like, I know, that's the magic of IPL. So.
Well, and so do you do the whole face when you do the treatment? Or is it sort of spot treatment kind of deal?
I like to do the whole face. You can spot treat, but most people, they kind of like the overall look. And for the majority of us, we didn't start taking care of our necks or bringing our products or sunscreen down, our necks and chest as well. So we try and include those areas too, because there's lots of sun damage there. So
yeah. Boy, I don't spend any time in the sun anymore. I didn't spend much time in the sun before, but
boy, I wish I
really don't.
didn't. Boy,
yeah.
I did, and I had the brown spots to prove it, but they're all gone now. Thanks to the old IPL.
Yay! Thank goodness. And are the hydrofacials more traditional type facial?
So hydrofacial they like for us to say it's more than just a facial. So it is a really deep cleanse. There's a mild peel. We use a glycolic acid peel, not like a one that's going to, make you're going to shed or your skin is going to peel, but basically it helps to loosen all those dead skin cells on the surface, because then we exfoliate, we do extractions, which is great for people that are experiencing breakouts or, hormonal acne, anything like that. And then we also rehydrate the skin with, peptides and all these things that help to brighten and give the skin a nice glow.
Oh, nice.
And you can do that really. Most people that come and do it once, they're like, okay, when can I come back? So we then try and book them for the next month. But you can do once a month. We do a membership where you come in every month and get your hydrofacial.
There's that punch card again.
I know. We have so many.
So because obviously this is close up and personal kind of activity, I have to ask, because of COVID, what safety measures you're taking when you're doing facials. And
yeah, that's a great question. So luckily now all the staff has been vaccinated, so that is that provides us a little more
isn't it nice to be connected to a physician who's connected to a place to get vaccines?
It is.
Yeah.
We are all so grateful for that.
Yeah, that's fantastic.
But Dr. Bass had taken some additional precautions, in just in the building itself, and you may want to talk about that.
Sure. We have a screening process like you're probably familiar with going to other practices where we take your temperature when you come. We ask you not to come if you're sick or, feeling the typical symptoms of COVID-19. And then we always wear our mask while we're doing procedures. If we are in someone's face and they need to take their mask off, we like to wear an N95 mask, just, for everyone's safety. And then when we built this building about a year ago, we put in a heating and air system that's new, and we installed some ionization filtration systems, which as the air circulates through the building, it destroys any kind of viral or bacterial particle that might be floating around in the air, just to keep the air clean and pure. And then we do, of course, cleaning between patients and are wiping down handles and surfaces and that type of thing. So we like to think that we're being as safe as we can during this COVID time.
Yes.
We also limit the number of patients that can be here at a time. We don't really want people to be walking in now. We really have asked everyone to make appointments when they come so that we don't have a lot of people in our front area at the same time. So we can keep our social distancing rules as good as we can.
That's great. That is great. And your place is really beautiful and has a very calming environment, and it's a lovely place for those of you who are interested in going. It's a beautiful place, and the staff is very kind and obviously very skilled. So it's a good place to get your skin fixed up and your abdomen tightened up and all that stuff.
Well, we're grateful to be here. It is a beautiful building. It really turned out so nice. We took an old building that was built in the 1940s in Oak Ridge and converted it into a beautiful home-looking medical spa. We even have a fireplace in the front lobby, which is kind of comforting in the wintertime.
Nice.
So we love it. Our patients love it. They really love our staff. All the devices are nice, but I think what they really love are Jenny, Tammy, Mandy, and Tammy. We have two Tammys, and Sherry, who work here. And they're just wonderful people. They're compassionate. They're kind. They're competent. They're so thoughtful about what they do, and they really care about their patients. And it shows, and our patients love them. There's 180 reviews on our website, and every one is 5.0 because of our staff. They're so great.
Well, I'm sure there's a top-down effect there as well. I think
Oh, absolutely.
You set that example and surround yourself with the people who are like you, which is wonderful.
It's a beautiful place, and we love our patients, and we're grateful they come see us.
That's fantastic. So do you all ever have specials? I know you have the membership thing, but do you ever run specials on anything?
Yeah, we typically will have a special or offer something on it at a discount each month, and it's on our website. We have a little tab called offers, and under there is right now a little button for February specials. There's a chocolate facial right now for chocolate, because chocolate is an antioxidant and has other good kind of healing properties, and so we'll do a facial now with chocolate, and then we also are offering a lip flip special and some lip filler special as well this month. So there's often a special or a discount that we'll advertise online.
There you go. Check it out. So they can find you at SheaAestheticClinic.com, correct?
That's right.
And I will put that on the Facebook page and on our website, so you can find it easily, SheaAestheticClinic.com. And I'm so grateful to both of you for sharing your time with me and with Forrest Winsel, our producer, and letting our listeners know where they can go to get spa treatment and feel beautiful and look beautiful. And I think it's fantastic that you're providing this service.
Well, it's been such a pleasure to talk with you, and we're really grateful that you came by here and sat on our Emsculpt chair and experienced that, and then given us time to speak with you and speak to your listeners. We're grateful for the chance, and it's been fun.
Yeah, happy to do it. Thank you so much. And I want to thank Function of Beauty and Care Of for sponsoring today's episode. I want to thank Forrest Winsel for producing and writing our theme music, and Stephen Brown for our artwork. Again, Dr. Bass, Mandy, thank you so much. Stay well, and we will see you next week.
Sweaty and pissed, sweaty